Hi everyone, we are from Lab 2 and we are going to present our research findings. Our topic is the prevalence of high caffeine consumptions and its associated factors among UKM medical students. So, our research mentor are Dr. Istiani and Dr. Faitzru, and this is our lab members. Introductions for research. Medical students are subjected to endless studying hours and exams which add extra stress to them, and they tend to work harder beyond the mental thresholds and physical strength. Caffeine. What is caffeine? Caffeine is a natural stimulant most commonly found in tea and coffee. And usually, caffeine is used to treat tiredness, drowsiness, and improving effects of some pain relievers. Caffeine addictions is defined as individuals consume high caffeine intakes, which is more than 2.5 mg of caffeine per kg of body weight per day. Justification of study. There's positive effects and negative effects of caffeine consumptions. So for the positive effects, caffeine helps to stay awake during or prior to exam. It helps you to stay more focused and alert and more energized. And other than that, caffeine is a countermeasure for tiredness and mental fatigues. On the other hand, the negative effects of caffeine included increase of adverse physical and behavioral effects, and also no net benefits for mood, alertness, and work performance. Objective of our research generally is to determine the prevalence of high caffeine consumption and its association factors amongst UKM medical students. How this is? Majority of UKM medical students has high level of caffeine consumptions. There's a significant association between demographic factors, biological factors, social factors, and perception factors with high caffeine consumptions. Literature review about perceptions on energy boosters and caffeine consumptions. Caffeine helps to increase alertness, cognition, and reaction speed, improve performance on tasks, increase energy throughout the days, to be more alert, more productive, help to stay up late, and also help with concentration. Caffeine consumption's effects towards BMI. Caffeine consumption helps to reduce BMI by stimulating thermogenesis and fat oxidations. Sex and caffeine consumptions. Males consume more caffeine as they are more physically active compared to females. Physical performance and caffeine consumptions. Caffeine improves physical performance when ingested both before and during exercise, and about 3 mg per kg of caffeine will increase the maximum power output when doing exercise.
Effect of caffeine on mental performance. It reduces sleepiness and enhances mental alertness. Its enhancement is offset by the increase in anxiety and jitteriness. There is no enhancement of mental performance due to the adverse effect from caffeine withdrawal. Next is age and caffeine consumption. As you can see from the table, the older the consumer, the heavier the caffeine consumption. According to studies, third and fourth year university students consume more caffeine. Next is relationship between smoking and caffeine consumption. More smokers and non-smokers are coffee drinkers. Smoking increases caffeine metabolism. Smokers consume more caffeine to achieve desired effects. This is a conceptual framework. There are various factors that affect high caffeine consumption, such as social factors, smoking, biological factors, the BMI, demographic factors, such as race, gender, your study, and physical activity, and perception factors, such as boost the study concentration, helping to keep them awake, increase alertness in the morning, enhance overall mental and physical performances, helps in losing weight, have addictive effects, disrupting their coordination, and have religious objections towards caffeine. Next is methodology. This is a cross-sectional study design and is conducted in the Faculty of Medicine, UKM, among first to fifth year medical students. The study was conducted between 20th October and 30th November 2017. The sample size was 180 medical students, 30 from each academic year. The sample unit consists of individual of medical students that meet the inclusion, that is all first to fifth year medical students of UKM. and those who fill up the questionnaire, and also the exclusion criteria, which are incomplete answering of the questionnaire and unhealthy people. Data collection. The data was collected from respondents using online questionnaires, which was distributed using Google Forms. The questionnaire consisted of 27 questions divided into 4 sections. That is demographic, biologic, caffeine, and caffeine perceptions and caffeine habits section. The data was collected, encoded, and entered into Microsoft Excel 2013. SPSS was used for analytical analysis. Descriptive analysis was presented as nominal data in the form of frequency and percentage. The association between each categorical form of independent variables with the research outcome was tested using Pearson chi-square test and Yates correction. Research findings. Females consume more caffeine than males, and Malays consume the most caffeine compared to the other races. Year of study, the 5th years consume the most caffeine. Non-smokers consume the most caffeine. People who are physically inactive consume the most caffeine, and people with normal BMI consume the most caffeine. Overall, the UKM medical students consume a high amount of caffeine. Types of caffeine beverage consumed. People consume instant coffee more than the other types of coffee, and they consume Pepsi Cola more than the other types of energy drink. Perceptions and beliefs regarding caffeine consumption. Out of all the perceptions, they believe that caffeine is addictive. Factors associated with high caffeine consumption. Out of all the factors, year of study is significant with high caffeine consumption. Out of all the perceptions, helping to concentrate while studying, helping to keep us awake, enhancing physical performance, mental performance, and overall performance are significant with high caffeine consumption. The conclusion, 79.4% of UKM medical students have high caffeine consumption. There is significant association between year of study and high caffeine consumption, but no significant association is established with other demographic factors. There is no significant association between biological factor and social factor with high caffeine consumption. There is a significant association in 5 out of the 10 perceptions with high caffeine consumption. These are the references used while doing our research. Thank you for listening to the presentation made by our lab, which is Lab 2. Have a nice day! I'm laughing.